today my topic is how to prevent knee from surgery. So, first of all, I would like to tell you about the osteoarthritis incidence. Right now, knee osteoarthritis prevalence in India is high and rising, with recent 2025 studies showing general population rates around 20 to 28%, which is significantly higher in the elderly, with pooled estimate for those 60 plus individuals reaching around 47%. So the people who are plus 60, they are having a high incidence of osteoarthritis. It reaches around 47%. So it's very important to get some awareness how to prevent it from that. So overall population that I already told you, 60 plus, a pooled estimate suggests nearly half suffer from knee osteoarthritis. It's more in, you can say, in urban areas. Rural area often show a higher prevalence than urban areas, might be due to their overactivity. So these are some major risk factors. Number one is age, a primary factor with prevalence increasing significantly with age. Gender, women are disproportionately affected, especially after menopause, because of the hormonal imbalance. Obesity, the patients are having high BMI, which is a significant contributor to disease development and progression. Socioeconomic factors, lower education and socioeconomic status are linked to higher rates. Previous knee injuries or any trauma, which a person having history of knee injuries and trauma, that can also lead to osteoarthritis. And genetics and hormonal changes, family history and postmenopausal hormonal decline play roles in they are the risk factor in of developing osteoarthritis. So I have divided three sections in this in my presentation. The section one is how can lifestyle and dietary changes can help in reducing and preventing osteoarthritis. So the number one and the most common part is maintain a healthy weight. The knees support the weight of the entire body above them. When the knees have to support greater weights, they will be subject to more wear and tear. Every 5 pound of weight on your body exert a force of 25 pound on your joint. Being overweight will therefore increase the risk of joint injury as well as developing conditions that affect your joints such as gout and osteoarthritis. You can reduce the wear and tear on your knees by losing some of the extra weight and getting down to a healthy weight. You can adopt an anti-inflammatory diet. Food like berries, turmeric, Spanish, tomatoes, these foods are help reducing the inflammation. You can stay well hydrated. Water is essential for joint lubrication. Proper hydration keep cartilage healthy. So proper hydration is needed. Limit sugar and processed food. As the age progresses, obesity and sedentary lifestyle can cause systemic inflammation, accelerating joint degeneration. So you can limit sugar and processed food. Ensure adequate calcium and vitamin D intakes. As you all know, is essential for bone density, especially in postmenopausal women and elderly individual. Adequate calcium and vitamin D is required. Incorporate omega-3 fatty acids in your diet. Sources like fish oil, flax seeds, walnuts, they all help reduce inflammation, protect cartilage. So omega-3 fatty acids in your diet is very helpful. Avoid alcohol consumption that can interfere with bone health. And you should avoid smoking also because smoking reduces blood flow to the joints, impeding tissue repair and recovery. Use joint-friendly grains. Switch to millet such as jowar and bajra. These grains are having a very good anti-inflammatory properties, which are rich in minerals too. So you can switch to them also. And some kind of natural supplement which widely available in the form of you can say tablets or in any kind. So glucosamine, chondroitin, and collagen, if prescribed appropriately, can also support joint health. Now the section 2 part. So how we will protect joint to get rid of degeneration. So the physical activity and joint protection. So we can go for 3 kind of exercises. Engage in a low impact exercise. All the exercises which we have to do is in a low intensity. Don't go for you can say moderate or high intensity exercises. So we'll start with walking. Mild walking can help in maintaining the joint mobility, and these exercises can also not causing any strain. Swimming is very good. Swimming and water aerobics, water-based exercises are excellent for people with knee pain because the water supports your weight, reducing the stress on knee joint while allowing you to strengthen muscles and improve cardiovascular health. Cycling is also very good. Cycling is a low-impact exercises that strengthen the muscle around the knee, improve flexibility, and boost overall joint health. Using a stationary bike allow for control movement and is particularly beneficial for those with more advanced knee problems. So cycling is very helpful. Strengthening supporting muscles. So we, as you all know, two major muscles are required for knee joint, hamstring and quadriceps. So we always go for some kind of strengthening exercises like straight leg raise. So I have one slide. These kind of exercises which we can do: knee press, just pressing your knees with your, pressing a towel with your knee downwards. Hold for some times. Single leg raises. You can raises your leg and hold for some times. Prone knee bending with weight cuffs. You can tie a weight cuff, lie down prone, and just flex your knees. Quadricep strengthening. These are quantum quads. Just sit on a chair and extend your knees and hold it for some time. So these are some strengthening exercises. Some wall squats. Stand with your back against a wall, feet shoulder apart and above 60 centimeters from the wall. Slowly slide down the wall into squat position, keeping your knees over your ankle and hold for a few seconds. Some hamstring curls. So these are the squats which you can do. This is a rather normal thing, but the elderly population can always go for all slides. Incorporate daily stretching. Together with strengthening, stretching is also very important. So some kind of stretches is also required, like hamstring stretch and calf stretch is always helpful in knee joint to improve flexibility and stiffness. So these are some diagram which can show. So this is the diagram that shows is the standing calf stretch. Keep your feet flat on the floor and your back knee straight, and just move your knee forward towards wall, hold for some times, and then relax. You can repeat it 3 to 4 times. Same for hamstrings. Bend forward from your waist as far as possible without keeping your legs straight, and try to move towards your feet. So these are some simple stretching which can be done. Practice yoga under supervision. These days, yoga is very helpful in maintaining flexibility. Asanas like Tadasana, Vrajasana, improving the joint alignments. So that can also be done. Avoid squatting or prolonged sitting on the floor. Apart from exercises and all the yoga, you need to avoid certain kind of postures like squatting and prolonged sitting on the floor. These position can increase knee joint pressure, especially in elderly patients. So don't, sit for longer time. Sometimes you can, but normally it's not advisable to sit long on floor. Use orthopedic footwear like a good arch support. Some patients are having flat foot, or you might have some deformity. So you need some kind of good arch support and cushioning, which will help maintain joint alignment and reduce impact. Some kinds assistive device is also very helpful, like walking sticks, knee braces, mobility aid. This can significantly reduce joint load and enhance safety. Uh, as far as use a handrail and avoid climbing stairs unnecessarily. It's very necessary, you can go for stairs, otherwise you should avoid it. Practice control movements. Jerky or fast movement can strain the knee. Mindful movement reduce injury risks. So don't go for any very fast movement exercises. Some I have seen some people are in park doing very quick exercises, very jerky type of exercises. That always I mean, there is always injury risk in that. So don't go for these kind of jerky or fast movement during any activity. And yes, of course, sedentary lifestyle is responsible for your knee joint problems. So prolonged sitting causing stiffness, movement every hour is recommended. So don't go for any prolonged sitting postures. So first part is diet, second part is how to prevent, and some kind of medical and therapeutic approaches is also required, because sometimes you don't know and your knee progresses to a moderate level. So at that time you need some kind of medical and therapeutic approaches. So early medical evaluation is very important. Don't delay seeking help. Early stage arthritis is much easier to manage non-surgically. So always it's better, if you find, if you feel any kind of pain, always go for medical evaluation. Don't ignore it, because early way is much easily to manage. You can always go for physiotherapy. Structural rehabilitation can help strengthen joint and improve mobility without medications. These days, orthobiologics like plasma rich, platelet rich plasma, PRP, or stem cell therapy is very, people are using it, and in early osteoarthritis there is a very good role. So what platelet rich plasma is, a concentrated platelets that having some kind of cytokines which a kind of growth receptors which stimulate the overall regeneration process, and it reduces inflammation also. It can decrease pain also, but it's also not a very permanent thing. So maybe for 8 months, 9 months you will feel some kind of things, but together with all the precautions, that PRP is also very helpful. Previously, people are very commonly use these injections, as you all know, hyaluronic acid injections for cartilage regeneration. Some you can say some kind of steroids are also available, but it's an option also. So you can always opt from these injections also, and that is also a very, you can say, a temporary thing. But if inflammation is very on a higher side, then you can go for steroids or this hyaluronic acid injections, which is basically for your cartilage regeneration. The last and very important part is regular imaging and assessment. So periodic X-rays or MRI help track joint health and guide timely interventions. So always, if you are having your X-rays, always go for an X-ray, or maybe if problem is more for MRI, and maybe after a year or so, so that you at least you have a knowledge, say how your joints are. You can track your joint health at that time. So it's very important. And the fourth and very important part is practical and psychological approaches. Prioritize mental health. Chronic pain can lead to anxiety or depression, which further amplifies pain perception. So body and mind balance is essential. So it's very important to prioritize mental health. Join walking groups or senior clubs, like staying socially and physically active increases compliance with healthy habits. Create a joint friendly home. Install anti-slip mats, elevated sittings and bathrooms. So you always have a something, there in your home, so to avoid accidents. So once you fall down, definitely your knee maybe got injured, and the existing problem get elevated. Stay informed, educate yourself but about non-surgical options instead of assuming surgeries. And whatever everybody is saying, if you are having knee pain, go for TKR. And these days people are saying it is inevitable, you have to go for surgeries, but we are having lot of people who are not going for TKR and they are living their healthy life. So it's not last, it's a last option, but not, you can always educate yourself how to prevent it with surgeries. So these all things can help in achieving that goal. Develop long-term knee health habits. Consistent movement, diet, and care is more powerful than temporary solutions. So don't go for any short temporary solution. Always go for a consistency in your movements, your diet, and care. So it gets a good results. Some kind of tips I have shown in the slides to avoid knee injuries. Apart from these osteoarthritis, the elderly population is also prone to knee injuries. So, as the knee, like any other joint in the body, are subject to wear and tear. As a result of year of use, while this wear and tear are natural, it increases our risk of suffering and injury. There can be luckily step we can take to reduce our risk of injury. You can make choices that will reduce damage and speed up recovery from injuries by changing some of your lifestyle habits and engaging in certain exercises to increase muscle flexibility and length. So some tips to help you avoid knee injuries. I already told you, keep your weight within recommended limits. You can start referring to a body mass index chart to determine what a healthy weight range would be at your height. Use this as a guide to help you maintaining a healthy weight and reduce the pressure on your knees. So keeping your weight within recommended limits is very important in controlling your osteoarthritis. As I already told you, all the exercises, leg strengthening exercises, they are always helping. Exercises can maintain adequate strength in the leg muscles, and it's important because it's improving support to the knee joints and preventing knee injuries. Strength training exercises have also been shown to improve bone density and slow the rate of muscles and bone loss associated with the process of aging. So you should focus on exercises that will strengthen the quadriceps, hams, and glutes. These larger muscles play an important role in supporting the knees. So these exercises that I already told you, you need to do to avoid any knee injuries. Same with flexibility, go for a lot of other simple stretching exercises because stretching can help to protect you from injuries associated with tightness of muscles, and it also you can say it will help you on reducing pain also. And it is important to be careful while stretching. Many people end up injuring their knees as a result of poor stretching practices. So you should be very careful. You should perform all the stretching very carefully. You should not stretch beyond your pain, and do not try to advance too quickly. And stop stretching when you feel pain. Engage in a low impact cardio exercises that I already told you: cycling, swimming, and walking. These exercises which help to increase the circulation of oxygen and nutrients rich blood flow to the cartilage and muscle around the knee. And exercises will also help to prevent atrophy of the cartilage. Thank you.